So Charlie, you and I know about the gap, and I'm just wondering if maybe we could have a chat about what it really is and what it means to us when we're treating our patients and what it means to our patients as well.
Absolutely. So in an easy to explain way, the gap is that bit of space, or dead space if you like, that is between the dressing and the bottom of your wound. So your wound doesn't have to be 2 or 3 centimetres deep. It can be only 1 or 2 millimetres in depth. But there is always going to be that gap. And if there's a gap, there is room for exudate to pool, for bacteria to grow, because we know bacteria like a nice warm moist environment. If we don't manage the exudate that is sat in that gap, it can spill out onto that wound edge and that peri-wound skin or that surrounding skin, causing maceration.
And for our patients as well, if we don't manage exudate and we don't manage the gap, obviously that's going to impact on wound healing, but it can also have an impact on smell. So the malodour that can come from a wound can have an impact on our patients, but also as well it can delay wound healing, and that has a huge impact on patients and their quality of life.
Absolutely. So with regards to managing the gap, it's about managing that exudate that is coming from that wound. It's about making sure that we fill that gap appropriately to prevent that build-up of fluid, that bacteria that can sit in those pools of exudate.
So simplifying care with a dressing that's going to manage the gap but also absorb exudate is really important.
Absolutely, and it needs to be something that, or a dressing that can conform down into that wound bed, because then you don't have a gap, and that stops that gap issue that we quite often find.
And that's good for clinicians because they can manage wounds, but also as well it's good for patients because they have a much better outcome and much better quality of life when they're living with their wounds.
Absolutely, and it allows for that shared care pathway to be followed.